Well, at the NINDS, we actually are just completing a over 2-year process to develop a health equity strategic plan, and this will help guide our funding initiatives and a lot of the things that we do over the next 5 to 10 years. And so, as part of that process, we actually hosted a workshop in September of 2021 where we had speakers to come and talk about various problems in health equity and neurological diseases. We had a request for information where we got information from the public in terms of what are areas of disparities in neurological diseases, and we got some really great input from that. And we had a large steering committee of experts from around the country as well that worked with us and came up with points that we have to think about when we're thinking of achieving health equity. One of the overarching themes that we came up with is that community engagement early is very important. It's important for us to work with the community. The community, that includes nonprofit organizations, professional organizations, community-based organizations, as well as patient groups as well. And so it's important for us as academicians, as clinicians who are doing work in neurology to interact and engage the community. That's important because if we have a relationship with the community, then we're able to enroll people from diverse backgrounds in our clinical trials. It's also an avenue for us to present the findings to the public and as well as to help people to deal with a lot of the health information, a lot of the health issues that they have related to neurological diseases.